Hi, my name is Dr. Randy Shively. I'm a Director of Research and Clinical Development here at Alvis, and I have an important topic to discuss with you today. I hope you have your PowerPoint packet in front of you. It should read Drug-Free Safety and Mental Health in Corrections. Today we're going to go through two major topics. The first will be mental health problems as we find them at Alvis today. And this presentation is going to give you examples and ways to respond to mental health symptoms you see in your facilities. The second thing we're going to do at the very end is discuss our drug-free workplace policy and procedure so that you understand as an employee what's expected of you in regards to substances. We need to be role models for our clients, and we can't be using substances in the facilities as staff or we're being hypocrites. So we're going to go over that policy and discuss what's expected from you. So let's get started today. And please follow your PowerPoint packet in front of you. Statistics and corrections. Mental health problems. 1 out of every 5 clients has some type of serious mental illness. I think you're seeing that in our facilities. We're getting higher risk clients that have serious mental health problems. You as a staff need to know how to respond to these clients to be successful and to lower recidivism rates. 30 to 60% of those with mental illness also have substance abuse problems. So there's co-occurring problems, and we're going to discuss that today. Those with co-occurring illnesses, meaning both mental health and substance abuse, often are homeless in the communities and often need medications to be able to function at even a average level. Across the country, individuals with severe mental illness are 3 times more likely to be in jail or prison than in mental health facilities. Our new mental health hospitals are our jails and prisons. That's a sad commentary, but so true. There's a lack of resources in the community, so there's fewer mental health hospitals and places for the mentally ill, and they end up often getting noticed and sent to jail or prison. And there's where they receive their treatment. So I think you're seeing in your facilities, we're more and more responsible for outsourcing, referring folks into the community to get their medications and to get their mental health symptoms treated. 40% of individuals with severe mental illness will spend time in jail, prison, or community corrections. So we're going to talk a lot today about this vulnerable population. Next slide. There was a study done in 2001 called the MacArthur Study. It was a national study that looked at violence in our country and tried to draw conclusions. Even though this is a little bit outdated, it really did discuss the mentally ill and how they function within the criminal justice system. So I wanted to talk about this study for a minute. What this study found, a few conclusions. Obviously, male offenders are more violent than females, and we already know that from the literature. But the mentally ill in general have often more contact with law enforcement. They get noticed in the communities, and the police are called at a high rate. Second, the mentally ill, their behavior is very erratic and gets them noticed. Third, they're more likely to develop substance abuse problems. If you're homeless and you're mentally ill on the streets, you're going to find ways to address your mental symptoms, and usually that's through substances. You numb the effects of the mentally ill symptoms you got. So substance abuse problems are likely to be found in this population. They medicate, illegally medicate to treat their mental symptoms. 1/3 of homeless have mental illness. So that's quite a few if you think about it, 1 out of every 3. But here's the take home from this MacArthur study. The mentally ill are not perpetrators generally of crime. They're victims. And most people don't realize that. Our media in this country presents it the opposite. They present that the mentally ill are the ones to be scared of, the ones that are blowing people up on the streets. But that's just generally not true. There are a few exceptions to that rule, but generally they're victims, not perpetrators of crime. Now let's talk about co-occurring disorders for a minute. Individuals with mental illness and substance abuse are twice as likely as individuals without mental illness to have community supervision revoked. So this is a very at jeopardy population and sensitive population You're seeing more and more of these folks in your facilities. So we need to be careful how we respond to them. They're a vulnerable population, and they often have to be approached with what we call trauma-informed care. This means our approach needs to realize that many of these individuals have been abused in their past and have serious problems that fuel their mental illness. So we're going to talk about some of the ways we respond to this population in this presentation. Now, let's talk about Alvis for a minute. Alvis is not a mental health treatment center. We don't set ourselves up that way. We refer people out to the mental health centers and to crisis centers when they're having serious episodes of mental illness. However, in saying that, we still need to know how to respond to this population and get them the help they need. This is the population, if we don't serve them well, it will end up being unsuccessful discharges, and will end up back out on the streets, not receiving the help they need. So it's very important we know how to respond. So here's a question for you to think about. Why is it important for you as an Alvis staff to be knowledgeable in the signs and symptoms of mental health? I think there's several reasons. I'm going to give you a few. First of all, you've got to identify if they're struggling or having problems. We often get mentally ill clients in our facilities that have never been diagnosed or never got the medications they need. You have to be able to successfully observe their symptoms and refer them on to get the help. All right? So that's the first reason. By you observing them well and getting them to the right person, which in your facility would be your clinician. Know who your clinician is, the person that can help you refer them. That's step number one. But second, we don't want to set our clients up for failure. And if I'm mentally ill and having an episode and you're the staff person, how you approach me is vital. I need to know that you understand what I'm going through and you're not condemning me or pointing a finger at me. So that's another reason we have to be knowledgeable of mental health symptoms. We have to know how to support our clients and get them the help, but not overreact and not make their problems worse. Third, showing empathy, that we understand. And empathy is not sympathy. Sympathy is feeling sorry for someone. Empathy is understanding that they're in a predicament and need help. So we have to show empathy to these clients. I often say as a psychologist, the most important thing you have as a staff is the ability to know your client. Because the better you know your client, you're going to understand when they're struggling and need help. So it's important for us to know mental health symptoms and have a basic understanding, because we're in a position we can help our clients greatly. Now, mental health is on a continuum. What do I mean by that? We all as people have mental health symptoms. I know on a bad day I may come into work and have crazy thinking. Why? Because I'm frustrated, tired, having a bad week. We all go through those moments. But that doesn't mean we all have mental health problems. There's a difference. So when does a mental health symptom become a serious problem? Well, usually it's when the person has trouble with daily functioning. They can't lead a normal life or an average life because of their mental health symptoms. They can't get to work on time. They can't respond to others appropriately. And they repeatedly have interpersonal problems. So when your mental health symptoms get noticed and you can't function in a daily routine, that is when it may be that you have a mental health diagnosis. Our population that you have coming in often is poorly diagnosed or not diagnosed at all. In prison, they don't always get recognized for their problems, and some of them try to hide their mental health symptoms. They may deny them. They may try to fit in. And once they come to Alvis, we discover that they've got some serious issues to be dealt with. So once again, if you think a client has serious mental health problems, get a hold of your clinician in your facility. Let them know you're observing some things. Document, we're going to talk about this today, the importance of documenting problems, and we'll refer them for help in the community. Next slide. What types of problems can you expect from clients? Well, with any mental health diagnosis, let's just take major depression for an example. There's physical manifestations of the illness, there's emotional manifestations, and there's behavioral. So for every mental health diagnosis, you have a physical state, an emotional state, and a behavioral state. What's a physical state mean? Well, when you have a mental illness, your body changes. You have unpleasant physical problems. For example, if I'm majorly depressed, I'm going to feel down. My body's going to be worn out. I may have trouble sleeping. And so my physical state is not in a good place. Emotional state. How do you function emotionally? Well, let's take depression, for example, major depression. Your emotional state, you're going to feel anxious, lonely, angry. You may have some suicidal thoughts, but emotionally you're going to feel down and in a lot of despair. And then finally, behavioral state. Every mental health problem has a behavioral manifestation. What's behavioral look like? Well, for somebody with major depression, it could be yelling, it could be self-abuse, it could be cutting on yourself, it could be refusing your medications, it could be just not sleeping and eating. So all these behavioral states we have to document. As I said, know your client. If you know something's wrong, document it, refer them on for help. You're doing them a great service, and you may help them successfully complete. Because here's my theory. Often we get a mentally ill client in, and if we ignore their symptoms or what they're going through, they're struggling. They're going to end up acting out in our facilities. They're going to be arrested, taken away. What have we done for that person? Not a whole lot, except for another failure experience. But let's take that same client. Let's say we observe their symptoms. We know they're agitated. We document. We refer that person to the clinician in the facility. They get them help in the community, and they're able to maybe get on a medication, come back to us from the community, and we can successfully work with them. Big difference, but that's what we're after. So once again, what are the 3 steps you need to remember? Well, number 1, don't overreact to symptoms you see in a client. Those 3 manifestations I just talked about. Don't overreact. Stay calm. Number 2, document what you're seeing. Put it in an incident report. And number 3, refer them to the clinician or directly to the community for mental health help. So once again, don't stay calm, don't overreact, document, and refer. We'll come back to that, but I want to just keep reiterating how important those 3 steps are. Now, what's the role of staff in responding to mental health behaviors? What's expected of you? Well, you're expected to know your client well enough to notice these signs of mental health when they happen. You need to approach the client calmly and carefully. If I'm experiencing a mental health episode, let's say I'm psychotic, I'm not dealing with reality, I'm hearing voices, and you approach me abruptly, I'm likely to whack you, smack you, or threaten you because I'm scared and you're invading my space. So how we approach a client when they're going through an episode of mental health is extremely important. We need to observe and listen to what the client needs. It's okay to ask questions when somebody's having a mental health episode. We want to have empathy, once again, understand where they're coming from. So we need to ask a lot of questions. But please remember, space is important. Don't invade somebody's space if they're in a bad place. Last thing on that slide, don't diagnose them. You may think, oh man, they're showing signs of major depression. And you may be right, but you don't have a mental health license. So be careful you don't give a diagnosis or a term to someone. But you can observe the behavior you're seeing and refer that, but be careful that you don't try to diagnose them, because sometimes labels can hurt people. Okay, other expectations. Once again, most mental health symptoms can be best dealt with by staying calm, encouraging clients to describe what they're feeling and thinking, and documenting symptoms, and passing these observations on to the clinician in your facility. So once again, the 3 steps: stay calm, document, and refer. Now, what's the worst thing you can do with a mental health client that's going through an unpleasant episode? Well, the worst thing you do is confront them, because they're already in an agitated state. They may not be successfully working on their programs, so drawing them to failure, drawing their attention to failure is not helpful when they're going through an episode. It's also not good if you're showing anxiety to the client. They need you to be calm, because they're already very uncomfortable because of the 3 states I already talked about. Don't blame them, don't belittle them, and don't stereotype them. Every two mentally ill people are different, so we have to show empathy and try to understand, not try to label them or stereotype them. So once again, every person's mental illness is very unique, and we got to get to know them. Just like any person, their mental illness manifests itself differently. So I line up 5 depressed people in front of you right here, in front of the camera. They're all going to have very different stories. They're going to experience their depression in different ways. Just because they all have the same diagnosis doesn't mean their mental illness is the same. And that's important to realize. That's why we have a lot of individual differences between people. And we need to get to know them, get to know your client. Now, what are the mental health groupings, the mental health problems you're going to see at Alvis? Here's the major ones on this slide. Depression. We see a lot of depression because clients are coming out of prison or being diverted from real uncomfortable situations in the community. They come to us and they're kind of down, and often they either have situational or functional depression. Anxiety. Some of our clients are very anxious just being with us, and sometimes their anxiety grows and becomes a mental health problem. Anxious people often do things without thinking. They often have trouble in interpersonal communication with others, and they often do behaviors that seem odd and repetitive and compulsive. Why? Because they're trying to alleviate that anxiety. They're trying to feel better about themselves. Next, we have clients in our facilities with psychosis. What is psychosis? It means you're not in touch with reality. For example, I'm hearing voices telling me things that aren't true. I'm actually hearing voices up in my head. Or I'm seeing things out there that aren't really there. So they're not in touch with reality. They're very scared usually when they're psychotic. And sometimes they're very paranoid, think others are against them. So it's very important to realize that how we respond to a psychotic client is extremely important because they're very scared and they're not dealing with reality. Once again, the 3 steps: stay calm, document, and refer them on for help. Then we've got a lot of drug problems in our facilities. So overdosing on alcohol or drugs is a key problem. And we could have a whole training on this topic. But what I would want to lead you to think about, we got to cut down on the drugs being brought in our facilities. So if you know somebody's using or suspect they're using, please document, because we need to keep a close eye on that person. Our drug influx into our facilities is one of our major obstacles to successful completion of our programs. So we got to be on top of it, but realize overdose on drugs and alcohol kills. We actually this year unfortunately have had 2 deaths early on in the year. We think both from drug overdoses. And both, I'm not sure either could have been prevented, but we do have a new, know about this. We have a new drug in our facilities called Narcan. It's in a nasal spray that staff are trained to use. So if somebody's overdosing, sometimes that can be reversed if we get them the nose spray in time. And that's usually with opioid overdose, like heroin. I think everybody realizes we have a serious problem with painkillers in this state of Ohio. And one of the main killers is heroin when it's laced with something called fentanyl, which is a very powerful drug. And if heroin is laced with the wrong amount of fentanyl, it can cause death. And we're starting to see some of that, not only at Alvis, but in other places too. And then finally, withdrawal of drugs and alcohol. We have a lot of clients that come in off the streets and they're addicted to different substances. So when they're going through withdrawal, often they have some very unpleasant symptoms. And some of the symptoms, for example, from alcohol withdrawal can cause death. So we need to be on top of it, observing as staff. And if you ever suspect somebody is withdrawing and having a serious reaction, please call 911. We got to get the people out of our facilities and looked at by emergency services, because sometimes time is of essence. A few minutes can make the difference between life and death. So, common mental health symptoms. For any mental health disorder or diagnosis, you've got a lot of unpredictable behavior. When someone's having an episode out of the blue, they can act very strange and different. Clients often scared and very unsure of themselves. Fear can be ugly. So we have to be on top of and documenting well and getting people referred, because they can act out in very scared ways at times. Their mood's usually negative and irritable, right? So it's very important to get them support and help and not overreact and not be anxious around them. Once again, staying calm. And the client needs you to help them orient themselves to their environment. If I'm going through a mental health problem, I cannot function and focus on what I need to be doing step by step throughout my day. I will need you as staff to help me if I'm going through a mental health episode. And reassure me things are going to be okay. I need that desperately, or I may come unglued. I may get erratic in my behavior. I may strike out. I may scream out. And all those things could get me removed from Alvis. All right, next question, next slide. What makes symptoms clinical problems? In other words, when do the symptoms get severe enough that we need to refer them and get them help? Well, frequency is one thing. If somebody's symptoms become frequent, and they happen over and over again in the facilities, I think it's time to get them addressed and looked at. Maybe the symptoms are just extremely severe. For example, in psychotic people that are not in touch with reality. Obviously, if I'm talking to the wall and not paying attention to you, and I'm talking to myself and I'm scared, that would alert you that something serious is going on with me. So if it's serious symptoms, it's better refer them immediately to get help. And we do have crisis services in Columbus through NetCare and through a lot of our satellites at your community hospitals. You have a crisis center. So please use those when you need them. And then if my symptoms are obvious in several settings, I'm showing a lot of depression not only at Alvis, but also in the community, also on the job, that should be an indication that I need to be looked at. And finally, if somebody's self-reporting symptoms that are damaging to them, and they're not functioning or coping, there's the word coping with their symptoms, that may be a good reason to refer them for help. So once again, what makes symptoms clinical problems? The frequency, the severity, seeing the symptoms in several settings, or the symptoms are just very damaging to the person. Next slide. Mental illness and mental health problems can basically cause recidivism. Somebody to go back to jail or prison, right? And what are some of those things you need to be aware of? Paranoia. Paranoia is something very difficult. As I said, in schizophrenia and sometimes in depression, people can get paranoid, think others are against them, think others are going to hurt them. And when somebody's in that state, they need you to stay calm and get them help. Often medications can help alleviate the paranoia. But if we don't get them help, they're going to fail in our facilities and they're going to go back to jail or prison. Substance use disorders. This can predict recidivism. It's not the drinking, it's the thinking behind the drinking. We often say that. But in substance use disorders, they have very erratic thought patterns. And we got to get them help because people in addiction often are their own worst enemies. They keep making bad choices in the way they think and the way they behave. It becomes pretty automatic. And we've got to break up that negative thinking. We've got to get them help. And usually it's with a cognitive behavioral perspective like we have at Alvis where we use our EQUIP training. But if we don't deal with the substance use problems, they're going to end up back imprisoned. Increased homelessness. I think we all know how important employment is in getting good housing for our clients. But if they're homeless, their chance of recidivating goes way up, because we talked about that in the MacArthur study. Those that are homeless with mental illness go to jail or prison. And then finally, we talked about prisons and jails being our new mental health centers. We want to change that, but right now we've got to do an effective job when they're incarcerated, getting them stabilized and getting them help so they can survive out in the community. Hopefully eventually they won't be homeless and they won't be that revolving door, but we've got to get them stabilized while they're with us. Let's talk about suicide and homicide for a minute. Suicide and homicide are both highly linked with mental health symptoms and drug abuse. Substance addiction is highly correlated Drugs and alcohol are often used to cope and a way to medicate mental health symptoms. So if I'm not on legitimate medications for my mental health problems, it's easier for me to go to illegal substances to try to stabilize myself. We call it self-medication. It doesn't work. I'm not a doctor. I don't know what I need of medication to make me feel better. But I become on the seesaw, this roller coaster, if I start taking illegal meds. But that's what often mentally ill people do. Unfortunately, it often leads to unsuccessful discharge. So that's why it's so important, once again, for you to stay calm, observe, and refer people out for help so that they can stabilize and get off that roller coaster. What we do at Alvis is we have what's called the Drug-Free Committee, where we're trying to stop illegal substances from coming in our facilities so people can't self-medicate. And the other thing we're doing is we're just being really vigilant at observing what's going on in our facilities. Because if you're a good observer, you can tell when things aren't right or when people seem high. And if they're high, we need to be what? Dropping them. We need to be on top of things so that they don't ruin other people's programs. What are some of these addictive substances we're talking about that are often brought in our facilities? Well, alcohol. I don't know if you guys know this, but there's a powdered alcohol now out on the market that I could put in any liquid to get high. So it's not just our traditional alcohol. It comes in powder form now. Caffeine. I don't know if you knew caffeine's a drug, and some of us that drink a lot of coffee, we understand how we can get caught up in needing that to stay alert. Marijuana. Marijuana is not one of the worst drugs, but it's not an innocent drug by any means. And if you're using marijuana from a young age, you can kill a lot of brain cells. Tobacco, we know how that's linked to cancer. Hallucinogens. This is not as popular as it used to be, but there's a lot of new party drugs like ecstasy that can really mess people up. Your more older hallucinogens, PCP, LSD, mushrooms, they're not as popular today, but they're still used by some circles. Then here's the big culprit, the opioids or painkillers. In Ohio, we have a serious problem still. A lot of it's in southern Ohio, but the corridor, I don't know if you're aware of this, the corridor for opioid transport goes from south to north, from Michigan, from Kentucky and some of the southern states, directly through Ohio on 71 and 75, all the way up through the northern states, up to Michigan and Canada. So there's a corridor. And often with that opioid transport, there's often prostitution, human trafficking, and it can get really ugly, some of the crime associated with that. Dayton, Ohio is one of our great leaders in the state trying to stop this. And how do they do that? They do it through clever, creative programs. They have programs now to address heroin addiction in a lot of the neighborhoods around Dayton. And they've also changed, this is kind of ingenious, but they've changed the roads. The roads around Dayton are hard to get on and off of the interstates. I don't know if you knew that. They've changed the exits to make it harder for heroin dealers to get on and off so they can catch more of them. So there's a lot of creative stuff happening in our state to try to slow this opioid epidemic down. Then you got your sedatives and benzodiazepines. You got your stimulants, and then you have a lot of other categories. We've heard of K2. We've still got a K2 problem in our facilities. That's synthetic marijuana, and it comes in different pouches, colored pouches and forms, but our clients often try to stay high on that. What's the problem with K2? Well, there's new batches being done every day. We've got people that are creating this drug synthetically, making new batches, and it's hard to know what chemical composition those batches consist of. And so there's a lot of overdosing on K2. And then we got bath salts. Not like the bath salts you put in your water, but these are crystals. They look a little bit like Calgon or bath salts, but they're wicked. People get into cannibalism and extreme aggression or self-mutilation sometimes when they're on this drug called bath salts. So be aware that exists. And then there's new chemicals coming on the market all the time. And our clients, unfortunately, often are the pioneers of some of these nasty illegal drugs that are on the market. So there are a lot of addictive substances, but let's talk about addiction. And how do we respond to addiction? Well, here's a quote. This was by a mother that dealt with her addicted son for many years. It says the following: I'm worried. It's the old pattern re-emerging again. The way it's played out in him many times before. The crazy times, I think of them. That's why this hyper-happy son of mine makes me want to cry, because it reminds me of all those times. Episodes of my life that are so bizarre and unbelievable, remembering them is like reliving a nightmare. Or being in some alternative universe with crazed people doing crazy things to survive and save the ones they love. I've never told anyone about those crazy times in my life, things I've seen and done and endured, trying to help him. So this is a mother that's kind of at her wit's end, realizing how nutty and crazy the addiction in her son has become. And it affects all care providers. Probably everyone out there listening to this knows one or two people in their life that has a serious addiction. And you see how it impacts and hurts the people around them. So what are signs of addiction? Physical dependence. Let's talk about opioids for a minute. Most all opioids, if you use them repeatedly, will create a physical addiction in no time. And with physical addiction comes both tolerance, needing more and more of the drug to feel the same way, the same high, and withdrawal, where when we're coming off the drug, we have unpleasant symptoms and we crave the drug again. Then you got compulsive and uncontrollable use with addiction. People use a lot more than they intended. They intended to go out and have 3 or 4 beers, and they end up going out and having 10 or 12 or even more. And they're unsuccessful cutting down. They promise themselves they're not going to use anymore, or are going to use a lot less, but it never works out that way. Then another sign of addiction is you continue to use despite negative consequences, right? You get arrested over and over again for DUIs, or you have relationships that are torn apart, and you promise yourself you won't use anymore, but you can't keep that promise. And then a new sign of addiction that's in the DSM, the new edition that came out last year, is cravings. I think anybody that's ever suffered with an addiction realizes even after you quit, you're abstinent from the substance for a length of time. And it may be a long period of time, the cravings can come back, even if you're not using the substance. So cravings have become an important sign of addiction, and they're very unpleasant. And then finally, feelings of remorse and shame. You know, you really are down on yourself. You realize you've hurt a lot of people with your addiction. People that are addicts go through these mood swings where they're very remorseful and feel shamed about what they did, but unfortunately it just leads them to keep using because they feel bad about themselves. So once again, signs of addiction: physical dependence, compulsive and uncontrollable use, continuing to use despite negative consequences, having unpleasant cravings for the drug, and feelings of remorse and shame. Other signs of addiction: you spend more time trying to obtain your substance than is healthy in your life. In other words, you neglect important other responsibilities to try to get your drug. Right? So you may give up social opportunities, you may give up your job, you may give up your family life to seek your drug out. And as you can see, it hurts a lot of people around you that are depending on you. And then finally, this is the saddest symptom of addiction. You have little understanding or awareness of the pain you're inflicting on others. You're hurting people through your use and your behavior, but you're not even totally aware of it, or you don't care at the moment. That's the saddest part of addiction. The people that get hurt because of your inability to see what you're doing. Now, staff, how do you respond to addiction when you see it in clients you're working with? Well, first of all, you confront the behavior, not the person. This is a very important concept. You can do a lot of damage and hurt the person by condemning them or shaming them. So what's important is to confront the behavior, not the person, separate the two. I hate the behaviors you're doing, but I like you. And let me tell you why I like you. That's very important because clients in addiction are on a shame game. They are really down on themselves. So it's important we don't fuel that. Second, educate people in addiction on what the drugs are doing to them and what people do in recovery. Education is extremely important when somebody's preparing to change. And I think we're aware of the stages of change. The model by Prochaska and DiClemente that says it's more important getting somebody ready to change rather than thrusting programs at them. In other words, if I'm an addict, it may take me a year, it may take me 2 years to get ready to change. And so how do you get me ready to change? You educate me, give me a lot of information to read, challenge me in my thinking, challenge me to look at what my life's become. That is how you're going to get me thinking in terms of recovery. But if you thrust a bunch of programs at me that I'm not ready for, I'm going to get frustrated and I'm going to shut down. So very important to educate. And we can do that in our facilities, right? You don't have to be a counselor to educate. You can get on the internet, print things out, give them to clients so they can read. Help the person see that their life stressors is not what's become unmanageable. It's their drug use, right? So everybody has life stressors, whether you're a user or not a user, right? So it's not your life stressors, but it's your drug problem. All right, other ways to respond to addiction. Develop a relationship that's engaging, non-judgmental, and full of listening. It's important not to judge, but to listen and educate the client. Don't expect a lot of change all at once if somebody's an addict. Do baby steps. Ask them a lot of questions. Engage them. But don't expect a whole lot from them. Sometimes at Alvis, we want to see major change in our clients. And sometimes that's a disservice to them if they're not ready. It's sometimes a small little bits of movement on a client's behalf when they're trying to just change one little aspect of their life. That can be a major accomplishment for some of our clients. So let's look for those baby steps and not expect too much of them. Never give up on an addicted client. Many of them have already given up on themselves. This is a very important concept. They're really hard on themselves and they've had so much failure. So it's really important that we give them the message. We're not giving up on them, even if they give up on themselves. And if you can give that message consistently to a client, you'll help them in the long run, right? And then final concept, 5 positives to every criticism. When I'm working with a client that's addicted, I need to build them up. I need to see what they're doing that's good. They may be doing a lot of bad things, but I need to see what they're doing that's good. So 5 constructive praises to every criticism. That's the model. That's the formula that will help somebody be ready for change. If we're getting down on somebody and drawing them attention to all their negatives, they'll give up quickly. All right. Let's talk about denial for a minute. Most people that have addictions have a lot of denial in their life. In other words, they either minimize or deny what they're doing or the impact it's having on others. They're like in their own little world. Often they blame others for their problems, personal or legal. It wasn't really my fault. If that officer had been doing his job, he wouldn't have clocked me at what he did. I mean, he's just not a good officer. I mean, they often blame others. They often falsify and lie to look better to others and to themselves, right? So this is all part of the disease. I probably should have mentioned this a few slides ago, but substance use, when somebody's addicted, is really a disease process that's going on in their brain. That's why the cravings come back years later. So we got to get them help and have them educated on what they're doing to themselves in their brain if they don't stop. So let's talk about this. Brain anatomy and addiction. This was in the New York Times. A good quote. Over the past decade, there's been a burgeoning body of scientific evidence that has indicated that an exogenous substance is less important to addiction than the disease process itself. The triggers, the changes in the brain. The brain is affected at an anatomical level. Its chemical messaging system and other mechanisms responsible for thoughts and actions get changed. These changes in the brain persist long after an addict goes through withdrawal. Drug-using cues and memories continue to elicit cravings, even in addicts who have abstained for years. Wow, a brain disease. That is what addiction is. It doesn't matter what substance you're addicted to, a similar process goes on in your brain. It's changing its chemicals, it's changing its structure, and if you don't get sober, here's the key, your brain will never heal. If your brain doesn't heal, you're not going to benefit from treatment, right? The worst thing I can do if somebody's not ready for treatment is throw a lot of treatment stuff at them. It just confuses them because their brain's in a fog, because they have this disease going on. But what does help, if they can stay sober for 9 to 12 months, that seems to be the range. The brain heals enough to lift the fog, where they can think more clearly and actually benefit from treatment. But too often we thrust them into treatment before they're ready. So the key we should be trying to get them is sober. How do we get somebody sober? Sometimes you have to put a lot of external consequences on them. What, urine drops, more visits to the probation officer, whatever it takes to keep them sober is important, because eventually when they're sober long enough, they start thinking clearly and they can make better decisions for themselves regarding their treatment. But before their brain heals, they're in a fog, they're in a bad place. All right, so we've talked a lot about addiction. So the best thing you can do for your clients is respond positively to these addictive signs. And what's the 3 rules we talked about, or the 3 steps? Stay calm when you're reacting to clients that have mental health or substance abuse problems, right? Observe and document. Know your client enough to document what's going on with him, and please refer him to the clinician or the community for help. All right, so now let's talk real quickly about our policy for drug-free use in the workplace. I don't know if you knew this, but over half of workplace accidents are related to employees using drugs or alcohol on the job. Isn't that amazing? You wouldn't think people would be using on the job, but they often do. 1 out of 5 workers are abusing drugs or alcohol on the job. So at Alvis, I don't know, we have almost 500 employees. You can do the math. But that's quite a few employees that potentially could be using. And do you see the damage? If an employee is using illegal substances or any substance on the job, we're being hypocrites. We're trying to help clients get out of their addiction. And if we're showing that type of role modeling to our clients, we're doing a serious disservice. So if you suspect another employee is using, the best thing you can do is try to get them help, report it, because it's only going to hurt you as a fellow employee, and it's going to hurt the clients we're trying to serve. Work stress is often linked with drinking problems. We've had over the years several employees that have had serious drinking problems. We're going to read the policy here in a minute, but what I would say to you, if you have a problem, please go get help. We got employee assistance programs at Alvis, and if you seriously take your problem to your supervisor and try to get help, more than likely you'll be able to keep your job. If you hide it and ignore it, obviously we can't have you working at Alvis, because it's setting a precedent of destruction for other staff and for clients. Okay? So, what I wanted you to do now is read the Alvis House policy, and then we're going to discuss it here in a minute. I'll give you about 3 minutes to read it. All employees, from the top down, wherever you are in the structure of the agency, you're all responsible for knowing this and following it. Any of us can get randomly dropped our urine. You will have to give a sample. I think it's 5% every month. So if your name comes up, it's on Alvis time. You have to go give a urine sample, and we'll talk about the policy in a minute. But please take a few minutes to read it. We probably want to keep the camera on.
Okay.
Because it'll be...
Sure.
Okay, let's talk about the policy for a minute. Let's summarize it. As I mentioned earlier, I think it's still around 5% of current staff get randomly assigned to be tested every month. So if your name comes up, you're not being accused of anything. Just go, it's on your work time, go give a urine sample. If it would come back positive, it's going to be tested twice. And you'll know before Alvis knows if your sample would come back positive. Now, if you're on a certain medication, when you go give your sample, make sure you let them know that, because that may affect the urine sample. We have an assistance program, an employee assistance program. So if you are struggling with a problem, it's really better to be transparent and open about it, because you can get help, and you may still be able to keep your job, even if you're struggling with an addiction. But it's important to let your supervisor know, because obviously if you're, and let me just make this statement, if you're using on the job, bringing drugs in, you probably will not keep your job. No, I can say not probably, you won't keep your job, because that can't be tolerated for obvious reasons. So please get help if you have a problem. Okay, just wanted to bring out a couple things in the policy before we wrap this up for today. If you have a medical problem and you're on a medication, you're only allowed a 24-hour supply of your medications at any one time. So please don't bring in a full pill bottle or anything. That's really important, because other clients may steal your drug, may sell your drug. I mean, it can cause all kind of problems. So you're only allowed a 24-hour supply. If you do need some counseling or some help for an addiction, you might be able to be granted a medical leave from your job to get the help you need. Once again, you got to work with your supervisor. Other things to realize: if you observe a fellow employee acting erratically and you suspect they're on drugs or alcohol, it's always best to report it. And the policy here dictates you need to report it because it's going to impact the whole operating of your facility. And I can tell you a few examples over the years where I've known staff that have used, and what has happened with the clients. It was not a pretty situation. So we don't want to put our clients in that situation, and you don't want to have to do a fellow employee's work because they can't function on their job. So I hope everybody realizes that this policy is very important. We definitely want to keep drugs out of our facilities, and we want to be role models for our clients to get the help they so need, desperately need. All right, so let's move on to the end. I want to summarize the training. 3 steps. I've mentioned a bunch of times, but you need to hear it one more time. Stay calm if somebody has serious mental health or substance use problems, right? Second, observe and document what's going on so people can follow up on it. And the third step is refer them to the clinician in your facility or out in the community to either the emergency services and or the mental health centers. We got to get people help as quickly as we can. Our job at Alvis is to stabilize our clients so they can be successful. And if they've got a serious mental health or substance problem and they're not stable, it could negatively impact them where they're either offending or being thrown out of Alvis House as unsuccessful. And we want to prevent that if we can. Take every threat of suicide and homicide seriously. If you think it's potential, follow the follow the suicide and homicide policy, which dictates what? The 3 steps there. You've got to send somebody to emergency services immediately if you think they could be suicidal. When they come back, you have to have an action plan in place to protect the client. And third, you need to involve the clinician in your facility to follow the person as long as they're on that suicide or homicide status. All right, so the most important thing about today, stay calm, learn about mental health. We've got a lot of trainings here at Alvis House. I'm sorry, there I said the house, can't get the house out. At Alvis, we have many trainings that will help you with mental health symptoms and substance abuse symptoms, but please learn more about these problems. It'll make you a better observer. Thank you for your time, and I hope you have a great day.